Closing the door for patient's privacy, washing my hand for 15 to 20 seconds as per CDC guidelines. Hi, my name is Frederick Lamusa. I'll be your student nurse checking for your head to chest assessment. Can you verify for me your name, date of birth, and your age, please?
Jenny Renters, 052577, 42.
Thank you, Jenny. Can you tell me why you're here?
Head to chest assessment.
Okay, can you tell me where you at?
I'm at the hospital.
Can you tell me what is the date today?
6/24/2020.
Thank you. So the level of consciousness for my patients is alert and orientated 4 times. I'm gonna go ahead and check for my patients. By the way, do you have any pain or allergies?
No pain, no allergies.
Okay, thank you. So I'm gonna go ahead and check for my patient general survey. My patient is looking upright, sitting upright. Affect is appropriate for the occasion. My patient is also overall hygiene is clean, and then there's no fall order for my patients. Now I'm gonna go ahead for my assistance before the assessment. Jenny, I'm gonna let you know that I'm gonna be touching most of the time. Okay, is that okay?
Yes.
Thank you. So I'm gonna go start with my patient's head. So I'm gonna palpate my patient's head. So patient is skin is intact. Do you have any tenderness? Can you feel any tenderness, Jenny?
No.
So okay, thank you. There is no lesions. Hair is evenly distributed. Color is appropriate for the ethnicity. Head is normal cephalic. And then I'm gonna go ahead and check for your range of motion. Can you look up for me? Go down. Go look into your left and then right. Thank you. So I'm gonna go ahead and check for my patient's neck. So a palpation to associate any tenderness, any abnormalities. And while I'm doing this, I'm gonna go ahead and check for my patient's lymph nodes, which is and this one is periauricular, post-auricular, superfacial, occipital, tonsillar, submental, submandibular, posterior cervical, and deep cervical, and also the supraclavicle. And then I'm gonna go ahead and do my assessment for my patient's eyes. Upon assessment, that the eyelashes and eyebrows are symmetrical and evenly distributed. No drooping of the eyelids. Now I'm gonna go ahead and retract your lower eyelids. For the sclera, sclera is white, no inflammation, and then conjunctiva is pink and moist. Now I'm gonna go ahead and check for my patients cranial nerve number 3, 4, and 6, which is doing that I'm gonna do for the pupil constriction. So I'm gonna go ahead, shine a light on your eyes, left eyes, and on the other side. Thank you, Jenny. So pupil are constricting. Now I'm gonna go ahead and check for my patients cardinal phalangeal gaze. So can you don't move your head, but can you follow with your eyes, with this finger?
Okay.
Thank you. Thank you. Now I'm gonna go ahead and check for my patients cardinal accommodations. Can you look at in your peripheral vision? That's right.
Mm-hmm.
Okay. There you go. Thank you. So and also perla is intact. Now and there is no presence of stagmus. And I'm gonna go ahead and do the assessment for her nose. So her nose is in the midline, and then nasal mucosa. I'm gonna go check your nose now. So nasal mucosa is pink and moist, and then I don't see any discharge. Now I'm gonna go ahead and check for my patient's cranial nerve number 1, which is, can you close your eyes for me? And can you tell me what did you smell?
Cinnamon.
Thank you. So cranial nerve number 1 is intact. I'm gonna go ahead and check for my systems for her mouth. So lips and mouth are symmetrical, and then I'm gonna go ahead and check for your mouth. Can you open it for me? Oral mucosa is pink and moist, and then there's no lesion and no visible tonsils. Can you stick out your your tongue for me? Can you say Okay, ovula is mobile, and then can you gulp for me? Thank you. See, in cranial nerve number 12 is intact. Can you swallow for me? Thank you. So the patient is swallowing without difficulty. difficulty. And then thyroid is in the midline, and then I don't see any. The thyroid is non-palpable. Now I'm gonna go ahead and search for my patient's assessment for the ears. Now I'm gonna check for. I'm gonna go ahead and check for any tenderness for the peanut and tragus. Yeah, go ahead and see. And then redness also. I didn't see that one. And then any discharge. The other side. There you go. Thank you. And then the nose. I mean the ears are symmetrical in line with the eyes. Now I'm gonna go ahead and check for my patient's cranial nerve number 5. Can you bite down for me, Jenny? Can you close your eyes? Okay. And then tell me if you feel any sensation every time I touch. Can you feel it?
Mm-hmm.
Can you feel it?
Mm-hmm.
Can you feel it?
Yes.
Can you feel it? Thank you. Now I'm gonna go ahead and check for my patients. I mean, cranial nerve number 5 is intact. I'm gonna go ahead and check for my patient's cranial nerve number 7. Can you tell me? Can you smile for me? Can you bite down for me? Can you do pop? And then can you close your eyes? Okay, thank you. So cranial nerve number 7 is intact also. Now I'm gonna go ahead and check for my patient's cranial nerve number 11. Can you do resistance on this side and on the other side? And then can you shrug your shoulder for me? Thank you. So cranial nerve number 11 is intact. Now I'm gonna go ahead for the assessment for the skin. So with this assessment, I'm gonna use my dorsal part of my hand for the skin temperature. Can you go ahead and extend your arms? So both are equally warm and dry, and texture is good, and then the hair distribution is well distributed. Hair distribution is well distributed. Lesion, I can feel it. I can see any lesions. The skin color is appropriate for the ethnicity, and then I don't see any edema also. And I'm gonna go ahead. Can you put down for me? I'm gonna go ahead and check for my patient's hydration. We're gonna skin survey. I'm gonna lift a little bit skin from your neck. Thank you. Skin return to its place quickly, which is a sign of no dehydration, and then it's no tempting. Now I'm gonna go ahead and check for my patient's nails. Can you stand for me and see your nails? So the nail color is good. I don't see any signs of any cyanosis, any sign of lesions, and then the thickness is appropriate. And then can you make sign of this so I can check your clubbing? So I didn't see any signs of clubbing. And then capillary refill returns intentionally for 3 seconds. Thank you. You can put it down. Now this is for the almost part last of my assessment, which is I'm gonna do with the respiratory assessment. Now I'm gonna go for check for symmetry. Can you take a deep breath for me, Jenny? Thank you. And can you return that turn that side? Can you take that deep breath for me? Take that for me. Thank you. And you can turn it back. So now I'm gonna go. I'm gonna use for my stethoscope. I'm gonna use for to auscultate using the diaphragm. So every time I put this, take a deep breath for me. Take a deep breath for me. Thank you. Take a deep breath. Take a deep breath. Take a deep breath. Take a deep breath. Thank you. Now I'm gonna go ahead and check on your back, and then you can turn that back to me. And then can you cross your arms for me? There you go. Now I'm gonna go ahead, the same thing that I did. Take a deep breath. 1. Take a deep breath. 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 Thank you. Now, upon the auscultation, and this is upon the arterial refractory, chest is symmetrical upon assessment, no signs of acute distress and or use of accessory muscle, and then the respiratory rate is 12 minutes per breaths per minute, and then it's it's in a regular rhythm, and upon respiratory and expiratory phase. So on the anterior and the posterior lungs, there is no adventitious sound present. Now I'm gonna go ahead and check for my patient's cardiovascular. Upon assessment, I don't see any signs of cardiovascular disease for my patients. Now I'm gonna go ahead and put my patients in the 45 degrees or the semi-polar position to check for any big. Can you lay down for me a little bit? Okay. Now I'm gonna check for GVD. Can you take that on that side? So check for any GVD, and on the other side also, Jenny. Okay. Now there is no bulging or GVD noted on my patients, and I'm gonna go also check for my broods on the carotid for my patients. Now I'm gonna go ahead and use the bellow of my stethoscope. So no bruise are noted. And then I'm gonna go ahead and check for my patient's PMI with the patient's clothes off. Upon palpation, there is no hips or lifts noted. Now I'm gonna go ahead and check for your heart. I'm gonna listen to your heart. I'm gonna also check for your S1 and S2 for the lab dubs. Now I'm gonna go ahead and check for your auscultation over the pericardium, over oscillatory sites. Now I'm gonna go ahead and every time I put this one, I'm gonna hit the diaphragm to check for the oscillatory sites. Starting with the aortic, the second intercostal space on the right sternum, and then the second one is the pulmonic, the second intercostal left of the sternum, the herb point, which is the third intercostal space left on the sternum, the tricuspid, fourth intercostal left on the sternum, and the mitral or apical, which is on the fifth intercostal space in the medicular line. Now I'm gonna go ahead and check again using the bell. This is the aortic, pulmonic, herb point, tricuspid, mitral, and that's it. So we're all done. And hold on, let me check. Upon the listening to your heart rate is 80 beats per minute, which is good. And then we're all done. Jenny, do you have any questions?
No.
Okay. So I'm gonna go ahead and lower your bed, and then put your sides rail up, and then I'm gonna put your personal belongings and call bell, and I'm gonna go ahead and check. I'm gonna go ahead and document your findings, and your provider will be here shortly. I'm gonna go wash my hand before leaving my patient's room. Thank you, Jenny.